I'm now going to hand over to Andrew Whitehouse, who's the Deputy Director of Communications for McKinsey Co, one of our partners for the conference, who's going to moderate a quick feedback session on the three parallel groups. Andrew.
Thanks, Callum. Good evening, everyone. Thank you very much for surviving through to the penultimate session. I'll be handing over to Jeff in just a few minutes to take us to the end of the day. What I wanted to do is to ask each of the chairs of the sessions in parallel to tell us a little bit about the core question that came up in their discussion, to give us a flavour for sort of the issues raised, the answers that came forward in relation to that core question, and then maybe say something about how all of that connected up into the theme for the conference today and for tomorrow. So maybe go to you first, Adam. Would that be all right?
That's fine.
The session on innovation in healthcare.
So I was lucky enough to chair a session with Professors Gwyn Bevan from the London School of Economics and Lionel Tarasenko from here at the Department for Electrical Engineering at Oxford. And our focus was very much on why are healthcare costs escalating in the context, very much focusing on the developed world, especially the dichotomy between the UK system with universal coverage but kind of limited overall costs, constraining spending, and the US system which lacks that universal coverage element but where costs are continually escalating. And that leads us to the concept of using cost-benefit analysis and how we should distribute resources in a healthcare setting. So the first big question we came to, and I'll run through three main issues we looked at. Should clinicians, should the system consider cost-benefit analysis when distributing healthcare? Should we be spending on someone who's near the end of their life, who has dementia very heavily to keep them alive for a short period longer, or should we be holding those resources back to spend on someone else? That especially was something we will look at in that context of the young versus the old. So the initial context is cost-benefit, how much does it cost to get one more good year of life or one more good unit of life, as it were. But then there's the other one of looking at, well, given the same benefit, do we favour certain groups over others? Do we favour the young versus the old, which was one of our focuses. Something the panel, I think, thought, and perhaps the room thought, was a reasonably good idea, but something that is now illegal under UK anti-discrimination law. The next main thing we looked at was e-health or m-health, so kind of health through mobile and electronic technologies, and whether this could in the future perhaps provide us with great healthcare savings, where it hasn't really up to this point. And one of the big reasons we looked at why that might be occurring in the Western world is what Professor Tarasenko referred to as the 25-year gap. Most of your healthcare expenditure comes towards the end of your life in the last few years. I don't know what your parents or grandparents are like, but mine are not really using Twitter very much. They're not on the mobile phone. They struggle to get onto the simplest computer-based technology. So there's a big gap there. The people who need some of this technology the most are those who are least likely to pick it up and be able to use it easily. There have been one or two exceptions, such as the Veterans Department in the Department of Veteran Affairs in the US, but there's been some accreditation of that success to the ability of that group of individuals to perhaps follow clinical directions better than most. One element that does look like it might be particularly helpful in delivery of E&M health, we thought was personalisation. So if you get a message that says take your tablet, versus if you get a message that says take your tablet signed off by your nurse or doctor, that appears to make quite a big difference in people's uptake of the technology. The final thing we looked at was, and we looked at this was really the smallest part of our conversation, but looking more directly at people power and how that influences decision making in healthcare. One of the areas we looked at there was, for instance, building up community-based support for something that actually may not necessarily be all that good or all that logical a use of resource in the healthcare system, such as a local community supporting their hospital to keep it open as a local resource, even though it's not performing very well and it's a drain on resources. And as a community, we'd all be better off centralising resources sometimes in a larger hospital setting. And the final thing we touched on there, again very briefly, but one that comes up all the time in the medical setting, is the internet as a source of untrustable healthcare information. But to think we could come up with a solution for that in an hour is optimistic.
Thank you.
Great, thanks Adam. Claire, you led a session on innovations in education.
Yeah, so we had two speakers in our session, Matthias Reeves and Peter Senils. So Matthias started the discussion by talking about the NGO that he founded in 2008. So that's COGC2013, which is committed to providing quality and equity in education in Chile by 2020. And he talked about the three areas that the NGO works in, which is the design of policies and provision of a roadmap for politicians, for providing support for school principals, and mobilising citizens. And one of the issues that Matthias focused on at the start was that actually they've been remarkably successful in the first of those objectives, which is in providing a roadmap for politicians. So he talked about the upcoming election in Chile this Saturday, and that the incoming president, had already committed to take on board the policies recommended by COGC2013. So we had some discussion around what was it that enabled them to be so influential, and in particular how they managed to build consensus. And he talked about the fact that they'd been an effective bridge between different groups in society, in particular between teachers, teachers' unions, students, political parties. And then we moved on to talk about mobilising citizens, and obviously COGC2013 is itself a citizens' movement. And Matthias was very positive about the possibilities for citizen empowerment and the possibility of improving education. Peter Senils then pushed back on that a little bit and wanted to talk about the pros and cons of increasing citizen involvement in education, and he focused on the use of parents in rural schools. So he's done work in Africa looking at parents being involved in monitoring of teachers, in particular whether teachers turn up at school or not. And he said that actually parents haven't proved particularly successful. So he said the key issues in rural primary schools in Africa, but in many countries as well, is that the schools don't function properly, that flow of resources from central government doesn't actually reach the schools, so there's some inputs that don't make it to the schools, and also parents don't demand education. So if people power is going to really make a difference, it needs to make a difference in those three dimensions. And he talked about the fact that parents aren't actually that effective in the setting in Africa, primarily because they actually have to do other things with their time. They need to work in the fields, it's a farming community, and that policy needs to recognise that whilst it's important to empower citizens, citizens also have other things to do. And we then moved on to a discussion from the floor talking about whether that was a particular constraint within the government sector, and perhaps we could empower citizens more effectively by partnering with the private sector. And by changing the organisation of schools, perhaps in greater involvement from the private sector, it may be easier to bring parents on board. So it was an interesting session talking about both the pros and cons, which doesn't always get discussed, about people power.
Great, thank you, Claire. And interesting to hear that citizen engagement clearly cut across both of the sessions that you led. Nari, was it a feature in yours as well?
Yes, absolutely. I mean, what Claire just said had its reverberation in a comment Denise Misne from the Lehman Foundation made on our panel. He said, you know, in Brazil there are hundreds and hundreds of schools where the teachers don't or can't teach, where the students don't or can't learn, but everybody's very happy. so let's not. But that said, we, in the panel on innovation in social policy, we had Rushanara Ali, who's a member of Parliament in the British Parliament, representing Bethnal Green, so representing a London, and in particular the borough of Tower Hamlets, a very challenging borough, and who talked us through reforms in schools, reforms which brought the community into the schools, which brought the parents into an engagement with the schools, and which proved successful. And Denise, who I've already mentioned, who talked through the work that the Lehman Foundation is doing in Brazil to personalize education, to bring, again, more engagement between students and the materials and those teaching them, as well as with one another. So much more collaboration where students are teaching other students. They started with, I think, 200 students, then went to 12,000, and now they're on track to try to take it to 100,000. So we had a rich discussion around that with lots of questions from the audience about it. 3 quick takeaways from it. One of the questions from the audience was, it's so easy to design public policy, but so difficult to implement, which is something that we're constantly debating in the School of Government. I think if we'd had a purely academic discussion, it would have been a discussion of public policy design with the results of randomized control trials, which came up, and data and incentives. And instead, those things were hardly present. The core element that came up in the practitioners' discussion of social policy innovations that worked was engagement. Engagement of the users, engagement of the frontline people who deliver. So remember Paul Collier talking about the frontline people, not forgetting what motivates them, their engagement and trust in them, and their trust in those both directing them and with whom they're working. Absolutely crucial to social policy innovation. Second lesson, data is great. We've heard that all day. There was agreement with Michelle Harrison's point that you can't think about, that there are some caveats. You've got to be a bit careful about the data, and in particular, not just what you're measuring, which can distort what people do, but when it is you measure. So one of the lessons was it takes real time for innovations to work. It takes persistence, it takes time. If you're too quick to measure whether they're working, you're going to too quickly discard policies that have effects that take time to bear fruit. And the third lesson was about scaling up and the need, and this was a point Denise made very eloquently, the need to design for scale if you're going to try to scale up. In other words, beware of undertaking a small pilot designed to be a small pilot and then trying to take that to scale, and in so doing, of course, dropping all the things which would make it difficult to take the scale and then wondering why it doesn't work. So if you're going to think about scaling up, design for scale from the outset.
Thank you, Nari. I think we probably have time for, say, one point or one question if there is one in the audience. Jamie.
Jamie Brooks from BNY Mellon. Thank you, that's very interesting. I guess my question is, from a selfish perspective, what role could corporates play in all this? What are they doing?
So Jamie, you're asking because presumably BNY Mellon is engaged, right?
I think so, yeah.
And
I think that, what was very interesting in the deep dive I was in was around how do we move from how we get students who are not able to have the skills, CV writing skills, the interview skills, and we've done some work in Tower Hamlets, for example, with dealing with some of those schools. But I just think, in general, I wasn't in all of the deep dive sessions, but wondering what can corporates do to help move this forward.
Okay, so the role of the corporate sector, the private sector, and innovation.
It was clearly touched on in one particular deep dive session.
Well, there was a point I didn't really bring to the table very much, but that ultimately the question of why healthcare costs are going up is partially laid at the feet of the corporates. Less to do just per se that people are living longer, but actually the costs associated with the new care and the new care technologies that are associated with not keeping people alive for longer, but even just caring for people who are living longer. And so that was one of our other focuses that I didn't initially mention. And so that when we think about the big innovations in healthcare, the big thing is how much are the next ones going to cost and why? And I think that's the big question.
So one of the things that came up in our session was actually a discussion around the issue of vouchers. So Chile was the country that Matthias was talking about, and it's unusual in that it's 64% of children attend private schools in Chile, which is far higher than in any other country in the world. And he said as a consequence of that there's actually a great deal of segregation. So the rich attend the schools that the rich go to, the poor attend different schools. So I think everyone in the room was positive about the role that the private sector could play, but it's thinking about how to increase the use of the private sector, but without it resulting in the levels of segregation that we see in Chile. Stephen Jennings, who was a participant in our session, was talking about the scope for private sector involvement and investment in Africa, and everyone was very positive about that. but without going down the route of the Chileans have gone.
Yeah, I'd like to crowdsource Jamie's question. I mean, because I think it was particularly about how you deal with getting graduates into jobs. And what came out in our session was that the thing that graduates don't have in the borough of Tower Hamlets is the human capital. They don't have the connections. They don't have the uncle who's working for JP Morgan, the aunt who's working for, you know, GE. They don't have the human capital to get in. So how could the private sector help bridge that gap and get graduates into jobs? Can I crowdsource it? Is there anyone who's got an answer to that one? There's a couple.
My sort of perspective is more sort of from what I've seen in like human rights and where students can get in. And I think there's sort of two issues which as students, sort of I know I've felt and I know a lot of other people feel. One is that if you don't have contacts, so if you don't go to say even schools like this, but you could just be a really smart student, if you apply to most of these organizations through their actual internship process, like I've been told by quite a few people that firms will not actually look at all these applications which come in because you'll get like 100,000 applications. So they'll only they'll only look at those applications if they've gotten some sort of reference. Or like an initial screening of CVs will only look at do you have Oxford or like Cambridge or some big name as sort of one aspect. And another thing is also I guess like the culture of unpaid internships, which I feel like a lot of students that really prices a lot of students out. It's been quite an issue, especially in the human rights sector, because there is an increasing culture of unpaid internships, which I feel is something we should have a discussion about.
My apologies to Andrew for taking us off-piste.
No problem at all, no. Thank you all for your very active engagement in the breakout sessions. Please join me in thanking our chairs for their contributions to this session.